Bismillah ar-Rahman ar-Rahim wa salatu wa salam ala Sayyid al-Mursaleen. Thank you to MEP for having us. Ever since I graduated from medical school, I've been hearing one thing: save a life, save a limb, and save a sight. We've always heard, do no harm. And I knew that if I continued with the traditional medicine, I was not saving sight, and I was actually causing harm indirectly. I knew then that the traditional medicine wasn't the thing, but the problem was, this was before the COVID, before anyone even knew what AI was, except the computer engineers. So you can imagine leaving your comfort zone. You're almost approaching 60. Mother almost had a heart attack. She said, you're not going to find a job, but I wasn't looking for a job. I wanted to serve the people. And the only way I could serve the people was by changing this traditional system. To be honest, people thought I was a wacko when I mentioned it to them. Then COVID kicked in. I know it was a tragedy to many people, but for me, it was a breakthrough because people realized, yes, AI is the way to go. At that time, there wasn't the garage, there wasn't the woman in tech, if you will. So NEOM actually incubated me, and I owe a lot to NEOM, because if it was not for NEOM believing in me, we would not be where I am today. So I resigned. I jumped over a cliff, not knowing where I was going to land. I went into an unprecedented territory that no one dared to do. And I did it not as a young person, but as a mother, a wife, an educator, and researcher. And that's how the story started.
That's where I jumped in the picture. I came from an investment background, very structured life, and I had one passion, is that I want to make a difference in life. And prior to joining or starting SEDEM with my mom, I was working with the government on stimulating the private sector. So we would work during COVID for at least 15, 17-hour working days or working hours, and we would consult the government on how to create stimulus packages. And I would sit on a daily basis with private sector, small companies, startups, even huge conglomerates, and how they can fight the regulation that's been changing on a daily basis to support the private sector. So I said, why am I doing this from the other side? I want to quit my job, and I'm going to jump on the cliff with my mom, and hopefully we're going to land on water.
And when he said he was joining me, I said, I can't afford you. Because he came from a very high sector, but he didn't care. He was looking, he said, I've heard you, I want to join you, and I will tell you, and I'm not saying this as a mother, since Naif joined, the startup has just grown tremendously, because I'm medical. He's the marketing, if you will, investment person. So what did I choose? I decided diabetes. Why diabetes? Why did we do our first? Because it's a pandemic. And it's a global, if you will, a global effort. Patients that had diabetes did not know they needed to be examined. Their eyes had to be, no, they didn't know that. They thought it was just diabetes. And then when they come to you, they say, please fix my eyes. They couldn't understand that the eyes was part of the body. So what I could never fix it. I could only treat the side effects. Why did we choose diabetes? Because globally only 55% are actually being examined, whereas here in the Gulf area and the Middle East, only 24%. Why? The pandemic goes at a faster rate than the human. So there was no choice but to do automation. So we started SADIA. And it was so interesting because we didn't know it was going to be called SADIA. It's Saudi Advanced Automated Retinal Image Analysis. And what do? It's really simple. We take simple photos of the retina that anyone can do. We teach the non-ophthalmologist. And we were able now to have a solution that is running in 14 different charity centers, from Tabarjal to Santa, from Jeddah to Dammam, and of course in the if you will central area. I remember when I opened the central area, I opened Unayza before Buraida, and my mother threw a fit. She says, "Why do you choose Unayza, where Naif is from, his father, over us?" But it wasn't, I didn't choose, it was, but so we ran, and Saria now has actually saved the site. So I did it, saved the site of 40,000 patients, and we do it free of charge. And all the underdeserved entities, all the underdeserved and underprivileged patients that cannot jump on a plane, come to Riyadh, or actually see Salwa al-Hazza. So it was like I cloned myself.
And that's when I jumped in again. Coming from a non-medical background, I understand nothing in medicine. I mean, I gained a couple of things in the past couple of years.
Oh, you're good now.
Thank you. So I decided, how can we go beyond diagnostics? How can we make it much more easier for people, like anyone sitting here in the audience, or standing here in the audience, sorry, can get information faster, more accurate, and literally at their handheld phone. So we decided to create Diabetic Advisor, which is basically a very tailored, specific solution that we equipped with every center that we work with, in terms of when the solution gives a result. Sometimes the patient or the practitioner does not understand the result. This solution gives accurate, more faster results, and it's using data that we have been feeding the solution for at least 6 to 8 months.
And this is why it's important to have someone non-medical, because I know everything, but not everybody knows. So having the diabetic advisor, because there is no physician on site. Now remember, it's not taking the place of physicians, it's only augmenting their work. So I came up with Sadim. Why? When you go and see a physician, you tend to see his back, because the whole time he's writing. So we did Sadim, where it's his actually voice, where they can understand, and within minutes everything is ready. The doctor actually gives you eye-to-eye contact. And then we did Samia, for you ladies that go and do a mammogram. Within a couple of months, the mammogram result will be coming out in minutes. You don't have to wait hours or days. It will actually be coming out in minutes. And that's Samia. Again, Saudi automated mammogram image analysis. We don't do it through the eyes, of course. We're doing mammograms, which assists the doctor, and you get the results.
And obviously, to make every company run and make sure that we don't go broke, I wanted to make sure that we are expanding. So with the talented Saudis that we have, and by the way, we are hiring 100% Saudis in our startup. 80% or 85% of our team are females. We wanted to make sure that with the power of engineers that we have, how can we go beyond healthcare? So we've been fortunate for the past couple of, I would say, a year or so. We've been working with a lot of other companies, a lot of other government entities to support making their workflow, their businesses much more optimized and much more easier at a lower cost.
So what are our accomplishments after succeeding by taking just a simple photo of the fundus, that you can even get your nurse who has no ophthalmology background, you can get your technician, a physical therapist, and this is what? His Excellency in the MCIT has always quoted us on what we do. He's pointing to his eye, showing the solution. Naif was able to go to space. Today we announced our space with the, if you will, he didn't go to space.
Yeah, I didn't go to space,
but
I watched the launch of one of the rockets with SpaceX and NASA back here.
We announced it today. Again, we were very fortunate. The World Economic Forum did a buzz video. May God bless her. Dr. Basma al-Buhairi gets us into this all world economic. So we were with the champion. We actually went with STC, and the list goes on.
So we don't want to bore you with all the accomplishments or awards, and not to brag about ourselves. But if you told me 5 years ago or 6 years ago now if you're going to be working in healthcare, I would tell you impossible, because the first thing I did when I graduated from high school was I'm not going into medicine. My brother did, so I was like, I'm off the hook. I'm doing something else. So if you told me 6 years later, I'm going to be working in a health tech startup, I'm going to be working with SpaceX and NASA, I'm going to be digitalizing a solution that has never been digitalized worldwide, looking into multiple diseases, I would say that's impossible. So I'm fortunate that I've been doing this for the past 6 years, and I'm even more fortunate that I've been doing this for the past 6 years with my mother.
Thank you. It's just, it's a blessing to have your own son with you, to see him. So these are all we're not going to talk about, but I'd like just to point to the CHI, which is the health insurance. We were the first to actually get the coding for artificial intelligence. They gave it, I wasn't expecting an award. I just wanted this to be a service, but the awards keep coming. So, CACS is on the top of the list, to be honest. Then, of course, we have all the others, the NTDP. NEOM, of course, was our anchor. You want to talk about the health partners?
I mean, again, being a healthcare startup, you have to focus and rely a lot on health, a lot on research. So we've been doing this for the past couple of years with all of our research partners, most recently that we announced today with Cornell University with our next space mission. But again, MENA, John Hopkins Aramco, the SFDA, all these are basically and supporting us and making sure that healthcare is accessible to all. Healthcare is not a privilege, it's not a necessity, it's a right for everyone.
And those of you that don't know Garage, this is considered the largest hub in the Middle East. With over 300 startups, and we have been very lucky that we are part of this, of the Garage. So what's the future? Everything I told you has been diagnostic. Now we are going into prediction, if you will. The prediction, we're going to be able to predict. Can you imagine, by taking a simple photo of the retina, which is the eye, we're going to be able to tell you or your loved ones, you're going to develop hypertension in 1, 3, or 5 years. Same thing with heart strokes. Why should you wait until your loved ones develop the heart stroke? We're going to tell you ahead of time. And of course, the Alzheimer, again, we're going to be able to predict it. And last but not least, 20 other diseases are in the pipeline, as because we have been very fortunate. Over 2,000 candidates submitted to RIDIA, the Research Development Innovation Authority, and we were one of the 4 that actually received, will be getting the grant. So I'd like just to conclude here that despite all the obstacles we've ran into, people at the beginning really thought I was a wacko. What is she doing? But I stand here with my son, and I stand here as a proud Saudi woman saying that the Saudi women in tech have surpassed, if you will, the G20. They have surpassed the European Union, and with 36% involvement, we, as Saudi women in tech, have surpassed the Silicon Valley. If that tells you anything about our government, the support to women, the support to youth, I can tell you we are truly blessed to be a youth, to be a woman in Saudi Arabia at this time. So please come and see us in Saudi Arabia. We have open arms for investments and international collaboration. Thank you all very much.